Scabies starts with a microscopic mite, an almost invisible creature that can cause significant discomfort. It's scientifically known as Sarcoptes scabii, a name that might sound intimidating, but understanding it is the first step to managing this condition. This eight-legged parasite, barely visible to the naked eye, burrows into the upper layer of your skin, creating tunnels as it moves. Once settled, the female mite diligently lays eggs within these burrows, perpetuating the cycle. The body, in its defense, reacts to the presence of the mite, its eggs, and its waste products, triggering an immune response. This reaction manifests as intense itching, a hallmark symptom of scabies, and it's often significantly worse at night, disrupting sleep and daily life. The rash typically appears as small, red bumps, often in clusters. Sometimes you might also notice tiny blisters filled with fluid. Keep an eye out for thin, wavy burrow tracks, which are telltale signs of the mite's activity beneath the skin. These signs are often found between fingers, on the wrists, and on the hands, but they can also appear on the elbows, around the waistline, and in other areas of the body. Scabies primarily spreads through prolonged skin-to-skin contact, allowing the mites to transfer from one person to another. It's important to note that brief touches, like a handshake, are unlikely to spread scabies. Crowded living conditions, like within families, where close contact is common, or in environments like schools or care homes, make outbreaks significantly more likely due to the increased opportunity for transmission. Sharing bedding, clothes, or towels can also, though less commonly, spread the mites. The mites can survive for a short time off the body, making shared items a potential source of infection. Importantly, it's crucial to understand that scabies is not a sign of poor hygiene or lack of cleanliness. Anyone, regardless of their personal hygiene habits, can get it. The mite simply seeks a warm body to inhabit, regardless of cleanliness, socioeconomic status, or any other personal attribute. Unfortunately, stigma and shame often lead people to delay seeking treatment. This delay allows the infestation to worsen, causing more intense symptoms and increasing the risk of spreading it to others. Recognizing scabies as a common medical condition, not a personal failing or something to be ashamed of, is absolutely crucial for prompt action. Early diagnosis and appropriate treatment are key to effectively stopping the spread of scabies and alleviating the associated discomfort. Therefore, if you notice persistent itching, especially if it's worse at night, and a characteristic rash, it's essential to seek medical advice from a healthcare professional promptly. Addressing scabies quickly and effectively not only protects your own health, but also safeguards the health and well-being of those around you, preventing further spread within your community. The relentless itch of scabies is more than just an annoyance. It's a siren call to scratch. This intense itching sensation can be incredibly difficult to ignore. And that scratching, while providing temporary relief, ultimately damages the skin's surface, creating a vicious cycle. Scratching creates tiny cuts and sores, often invisible to the naked eye, but significant nonetheless. These breaks compromise your body's natural protective barrier, weakening its defenses against external threats. These open wounds, however small, become easy entry points for bacteria, opportunistic organisms ready to invade. These bacteria normally live harmlessly on the skin's surface, coexisting peacefully. Warm, moist areas, the very places where mites thrive and burrow, are also perfect breeding grounds for bacterial growth, creating a double whammy of infection risk. Scratching not only introduces bacteria already present on your skin, but also introduces bacteria from your nails and forcefully pushes them deeper into the skin layers, bypassing the surface defenses. This unfortunate sequence sets the stage for a secondary bacterial infection to take hold and flourish. The seemingly simple act of scratching transforms a manageable mite problem into a far more serious and potentially complicated bacterial one. Pain, often intense and throbbing, swelling around the affected area, and the formation of pus can follow, significantly worsening the rash and discomfort. This is the critical link. Mite causes itch, an unbearable sensation. Itch leads to scratching, a natural but harmful response, and scratching opens the door wide for bacteria to invade. If left untreated and unaddressed, this seemingly simple chain reaction can escalate far beyond the skin, leading to more serious complications. Therefore, understanding this crucial step is vital to fully grasping the true extent of the risk associated with untreated scabies and the importance of breaking the itch-scratch cycle. When bacteria invade scratched skin, impetigo often develops, It's common in children and highly contagious, showing as red sores that ooze and form a yellowish crust. The main culprits are Staphylococcus aureus and Streptococcus pyogenes, bacteria many people carry harmlessly. Scabies increases the risk of impetigo by providing an ideal environment for bacteria. Scratching drives bacteria deeper, bypassing natural defenses. The combination of scabies and impetigo is so common in some regions it's seen as a single disease. Streptococcus pyogenes is especially concerning, as it can trigger serious complications. The immune system's response to this bacterium can go awry, leading to problems beyond the skin. Impetigo marks the escalation from a simple infestation to a dangerous bacterial infection. Treating both scabies and the bacterial infection is essential to prevent further complications. Here's where things get serious. Your immune system can mistake your own tissues for the bacteria it's fighting. Streptococcus pyogenes has proteins similar to those in your heart, joints, and skin. Sometimes, antibodies attack both the bacteria and your own body, causing acute rheumatic fever. This inflammatory condition can develop weeks after an untreated skin infection. Symptoms include fever, joint pain, fatigue, and sometimes involuntary movements. It's not the bacteria, but your immune system causing the damage. While less common after skin infections than strep throat, the sheer number of cases in some regions makes it a major health issue. An untreated skin infection can set off a chain reaction leading to lifelong health problems. The most devastating outcome of rheumatic fever, a condition stemming from untreated strep throat or scarlet fever, is rheumatic heart disease. This serious condition can have long-lasting and life-altering consequences. Inflammation from the immune attack, triggered by the initial infection, scars the heart valves, leading to a variety of complications, disrupting blood flow and impacting the heart's efficiency. Valves may become stiff, a condition known as stenosis or leaky, referred to as regurgitation, forcing the heart to work harder to compensate for the impaired function. Over time, this strain can lead to heart failure, a debilitating condition where the heart cannot pump enough blood to meet the body's needs. Shortness of breath, making even simple activities difficult, and swelling in the legs and ankles due to fluid retention. Rheumatic heart disease also raises the risk of blood clots forming in the heart, stroke, if a clot travels to the brain, and heart infections, such as endocarditis, which can further damage the heart. The damage is permanent, leaving lasting effects on the heart's structure and function, and often worsens over years, leading to a gradual decline in heart health, sometimes surfacing long after the initial infection has been forgotten or dismissed. Many only discover the problem as adults, during routine checkups or when symptoms become too pronounced to ignore, long after the original scabies and skin infection are forgotten, highlighting the insidious nature of this disease. This is the tragic chain, a sequence of events that can have devastating consequences, mite to itch. The initial discomfort caused by the infestation, itch to wound, as scratching breaks the skin and creates openings, wound to infection, when bacteria enter the broken skin and cause inflammation. Infection to immune attack, as the body's defenses mistakenly target heart tissue, and finally heart damage, the irreversible result of this misguided immune response. A treatable skin condition, if addressed promptly and effectively, can become a lifelong, incurable disease, significantly impacting quality of life. Early intervention is critical to prevent this outcome and protect heart health. Scabies and its complications hit hardest in poor, crowded, and tropical communities. Overcrowding makes close contact and mite transmission almost unavoidable. Limited access to healthcare means infestations go untreated, increasing risk of severe complications. Lack of clean water and sanitation makes it hard to eliminate mites from homes. People may be treated, only to be reinfested from their environment or untreated contacts. The disease becomes endemic, a constant presence in daily life. These factors, overcrowding, poor healthcare, and inadequate sanitation, create a perfect storm. Rheumatic heart disease is often called a disease of poverty, reflecting deep health inequalities. Indigenous, rural, and slum communities are most affected. Preventing scabies in these settings is a matter of health justice. The good news? We can stop this chain reaction right at the very start. Prompt diagnosis and treatment of scabies is truly the best defense. If you notice an itchy rash, especially at night, see a doctor. Don't ignore it, seek help. Treatment is simple, medicated creams for everyone in close contact, plus washing bedding and clothes thoroughly in hot water. Environmental control, washing or isolating items, prevents reinfestation. Raising awareness and reducing stigma are vital, especially in vulnerable communities. Public health campaigns and mass treatment in high-risk areas work. By treating scabies early, you protect yourself, your family, and your community from preventable heart disease.